through June. So the model had to be kind of reworked and become a more fluid depiction of what these organizations were going to need. And we definitely had to do that with our domestic violence communities because they served victims, they served batterers, and they served kids in schools. So we had 3 different populations that we could not give the same survey to. And again, these are just the results of that. I just have a list of our outcome projects to date. As you can see, there are 9 of them on here. We have 3 more that have just completed, and we're beginning 3 as of September 1st. So we're hoping to be complete with all of the rest of our funded programs by, I think, 2011 is our target. Just some lessons learned really quick. You have to have a base of programmatic outcomes. It's essential. If you've never done outcomes before, it'll be really hard to jump right into community outcomes because a lot of the information that we got from our organizations were from the outcomes that they had already been using. You have to gain the trust from the program partners. We struggled with that in the beginning. Now people are knocking down our door. When are we going to do our community outcomes project? When is, every individual and family counseling organization that I went to in the past year was like, please, we need this. We have to do this. We were able to use a consultant for some rationale and some research. It's not essential. We don't do it for every one of our programs. We've done it for the ones that we felt that we ourselves as researchers may not have the right expertise to do. The measurement tools will be vastly different depending upon the issue area. Training. Demographic information has to be collected. Even in pilot years, we made that mistake the first year where we didn't collect demographic information and it screwed us up for 3 years. So that's really important. Data collection tool has to be as simple as possible. The length of the process, depending upon how many organizations are in the process and where they're at in terms of what they're collecting, it can take anywhere from 6 months to a year. And absolutely have to pilot the process. The outcomes are not set in stone, as I said before. As the community changes, the outcomes can change too. And each pilot process, every time we do a pilot process, we improve. We have gotten it down to a good science, but we learn something every single time. In terms of moving forward, as I said, we're continuing to do this with all of our issue areas. It's our intention to collaborate with other funding sources, and that's been like my mission, is to try to get other funding sources to at least sit down at the table and talk about this. We're getting there. We're not there entirely. We are working with eCImpact to help us be more technologically efficient for both ourselves and our organizations. Whew, that was a lot of information. So if you have any questions.
We do have a question. I do want to tell everybody, if you'd like to ask your question directly to Dawn, just utilize the little raise hand option, and I can unmute you, and you can do that. But actually, we do have a question here, Dawn.
Okay.
Elaine Galway is asking, did you create a community report card to share your findings with the community stakeholders?
We did. We created something called Community Outcomes Project Meaningful Impact Measured, which is basically gives all of our results to our donors. We also took from that and put together white sheets, which in marketing communication land is basically a sheet of paper that is either one page or a back and a front that lists all of the results and the comparison between the first year to the second year, or or all 3 years. So we most certainly did.
Great, thank you. Please, let's ask some questions. I know that this is a hot topic for everyone, and Dawn is certainly the person to answer your questions. Again, thank you so much for doing this for us all, Dawn.
Sure.
With that being said, does anybody have another question for Dawn? Oh, here's one. Sharon Hutchins is asking, are you willing and able to share your tools?
Well, I have a two-part answer to that. The first thing is that I'm more than willing to share the tools. However, I really encourage you to, if you're going to implement anything, that you engage your program partners. You can use it as a basis for a beginning, a start, but to take it and implement it in your community without getting the buy-in from your program partners, that I don't encourage.
Okay, thank you. I see here we've got a question from Brenda.
Mm-hmm.
Brenda, you should be able to go ahead and ask your question to Dawn now.
Actually, it's going to be Tyler, who's our AmeriCorps that's working with us on community impact. So hold on.
Hi, okay.
We're currently working with a local consulting firm right now, and we're trying to get the ball rolling on something similar to this. And we're having some trouble identifying indicators to track our outcomes. We've sort of got our outcomes figured out, actually communicating those to the group that's working on the project right now still needs to be done. But we're having trouble with the next step, and that is moving forward to identify indicators to track the outcomes. I was wondering if you could give us a little bit more information on a good strategy for that.
Sure. Really what we did is we asked the organizations that were sitting around the table what types of measurement tools they had previously used to track the outcomes they were previously looking at. And we took those measurement tools and we looked at all of those measurement tools and we pulled out indicators from those measurement tools. We said, okay, well, if you're looking at school engagement and you want to know whether, a kid is completing their homework on time, somewhere in that measurement tool is a question regarding completing their homework on time. Somewhere in this other tool is a question about did a kid go, attend school the entire school year unless they were sick. Okay, well, let's pull that indicator out and use that question. So it was really looking at the tools that were being utilized already by the organizations and not reinventing the wheel. Does that help?
Yes, it does. Thank you very much.
Good.
Okay, let's see here. We have a question. Someone just chatted in. Julie Durham is asking, as a United Way organization, are you using the education, income, and health areas and indicators in any way?
We are not. We are not following the United Way of America model simply because of our population. We have a lot of it. We're a very, very poor community, and we have a lot of people in our